Hi everyone, I just wanted to show you what would have been the last few slides for yesterday's class if we'd had time to get to them in case they're useful for you in preparing for tomorrow's quiz and or for the second test. So the next slide that we would have gotten to if we'd had even one more minute in class would have been a question for you about the autonomic nervous system. So if we know that when people have asthma attacks, one of the major things that happens to them is that their bronchioles constrict, and therefore they have difficulty getting enough air to and from their lungs to breathe properly, or they have trouble breathing properly in order to get enough oxygen into their tissues and carbon dioxide out. So what should we give them? So the way you should approach a question like this, in my opinion, is to say, well, which of the two systems do we want to activate here? If we know that there's not enough air getting to the lungs, so what we want to do is open these airways. And is opening airways something that you would need to do to run from a puma? Yes. So therefore it must be the sympathetic nervous system that opens airways, and so it must be that one that we want to activate. So then if you look down through your choices, choice A is something that activates muscarinic acetylcholine receptors. And if you don't remember which system that's involved in, you really need to go back to this slide. And you should really know this slide because that's the only way you're going to be able to answer questions like that, which I'm very likely to ask you, and which is the only way of really understanding these systems. So look at that, and you say, okay, well, it's a muscarinic receptor, so that's a parasympathetic pathway. So we don't want to activate a parasympathetic pathway, so A can't be right. In choice B, we have an adrenergic receptor. So remember, adrenergic refers to a receptor for epinephrine or norepinephrine. So that's good, right? Except we have an antagonist. So there's a drug that's going to block the sympathetic nervous system. So we don't want that. Choice C, agonist. So we're going to activate for beta adrenergic receptors. In this question, you don't have to worry too much about alpha and beta, but your book describes where these two subtypes are located. So we're going to activate a norepinephrine receptor. So that sounds good because we know that norepinephrine is the sympathetic neurotransmitter. So we're going to activate the sympathetic nervous system there. So that sounds good. The last one is an antagonist. So it's going to block what? Nicotinic acetylcholine receptors. Well, in the autonomic nervous system, nicotinic acetylcholine receptors are up here at the ganglion. They're not at the target tissue, so they wouldn't be at the lung. So it probably wouldn't have much effect either way on the lung tissue. It would affect both of these, so they'd probably cancel each other out anyway. And regardless, it's not something that would be acting at the target tissue. So C is the best answer for this question. Okay, so chapter 11 is mainly about the autonomic nervous system, but you'll notice it's not called that. It's called the efferent nervous system, or outgoing or motor nervous system are synonyms for efferent. So it actually discusses the other side, so not just the autonomic nervous system, which most of the chapter is about, but a little bit about the somatic motor system. Now, we don't say much about this because the whole next chapter is about muscles and how they work. But the chapter does talk a bit about their control, sort of this arrow here, how the central nervous system carries information out to the somatic motor system. There's a couple of really important differences between control of the autonomic system and control of the somatic motor system. First of all, the heart beats by itself. Blood vessels carry blood around by themselves. The small intestine squeezes food through it, chyme through it by itself. Whereas the autonomic nervous system then can only modulate these, right? The heart beats, and the sympathetic nervous system speeds up that heartbeat, and parasympathetic decreases it, but the effect is the same. That is, the effect is only modulatory. It's not something that's going to activate it. Whereas in the somatic motor system, muscles don't contract on their own. So if there's no input to a muscle, it won't and can't contract. The only way that muscles contract is if skeletal muscles contract is if they receive signals from the nervous system. A related difference is that the autonomic nervous system can either stimulate or inhibit its organs. So the sympathetic nervous system will stimulate the rate of the heart beating, but it will inhibit the rate of contraction in the small intestine. So same system can either increase or decrease the activity. But again, this is not true in the somatic motor system, where the only thing the nervous system can do is tell muscles to contract. It never tells them to relax or to stop contracting. The only way it can do that is by stopping telling them to contract. So all of the signals that come through this arrow here are stimulatory signals, whereas this arrow includes both stimulatory and inhibitory input. So if you look at the pathway for the somatic motor system, you see that it in fact is only one neuron. So that's a third difference between these two systems. That in the autonomic system you have two neurons, the one and then the ganglion and then the second one. Here you only have one. And then if you look at the receptor on the end here, this is a nicotinic receptor, which means there's no modulatability. It's not a muscarinic receptor, which is a metabotropic type receptor. It's just an ion channel. So if you bind acetylcholine to that receptor, the ion channels will open, the muscle will contract. So there's no modulatability here. It's just an excitatory stimulus that makes the muscle contract. So it's really a much simpler system than the autonomic nervous system. The question related to that system was just to make sure that you know about these receptor subtypes. So which of the following would directly increase muscle contractions? I really should have said skeletal muscle contractions in this question. If we assume that I mean skeletal muscle contractions, then the only one of these that really makes sense is nicotine. So epinephrine is an agent. First of all, it's a hormone, but it can stimulate some sympathetic target tissues. But we're not looking for sympathetic, we're now looking for somatic target tissues. Muscarine activates muscarinic acetylcholine receptors, but here we need nicotinic acetylcholine receptors to be activated. Nicotine, as the name suggests, will activate these nicotinic receptors. Curare actually also relates to nicotinic receptors, but it's an antagonist. So the way if you were hit by a curare tipped arrow from someone, then that would block your ability to contract your skeletal muscles, run away, breathe, because your nicotinic acetylcholine receptors were blocked. Atropine acts on muscarinic receptors. You can look up, sort of drugs and agonists like this in Chapter 11. There's a table that might be useful for you that's located there. So atropine acts on muscarinic acetylcholine receptors. So the only answer that makes sense here, and you would need the book to know all of this, but the only one that makes sense here is the nicotine. Okay, so if you have questions about any of this, just let me know. I'll be here in my office for a little while, and then you can send me emails and ask me tomorrow as well. Okay, bye.